Today's cardinal lesson, we're talking about Medicare Supplement, or it's also known as Medigap insurance. And this is the time of year, at least when we're filming the video. Some of you may be watching this thing a year or two from now or in the off season, but this is annual enrollment period, October 15th to December 7th. And it's just the time of year when everybody, all the TV, commercials, everything's rolling. People are all in a buzz about Medicare. And Medicare Supplement and Medicare Gap really has almost nothing to do with annual enrollment. So the annual enrollment period is about Medicare Advantage, or Part C and Part D. And so it's the time of year when you can make change plans, come in, leave it, all that kind of stuff. Medicare Supplement and Medigap is for if you're on original Medicare, Parts A and B. And many of you are on these plans now. Many of you are turning 65 and you're approaching Medicare and you are deciding whether you want to go original Medicare and then buy a supplement, or you're going to go Medicare Advantage, and then you don't need to know about this, because unless you're just comparing it. But if you're going to go Medicare Advantage, that's a whole different decision, and you're not on original Medicare anymore. So some of you have been on Medicare for years and you have a supplement, but you would have trouble telling me exactly what you're paying for it. And then you might have difficult telling me whether you're on which one of these plans you're on. Many of you, though, could. You're going to say, I'm on a plan N, or I'm on a plan G, or I'm on a plan F, or you're going to tell me something like the F went away in 2020. Much of that is not necessarily true. So what I'm going to do today is just show you kind of the whole world of Medicare Supplement and Medicare Gap and help you make decisions about this, and then point out some things that you might want to do if you're already on this or you're going to go on this. I'm going to give you a couple of simple lessons that you need to do when you're picking this so you don't end up paying too much or you end up missing some benefits that are going to be important to you later. So I've been offering Medicare Supplements since 1976. I sold my first policy to Jessie Baird in Minneapolis, Minnesota. She was 82 years old, so she'd be 115 or something today. And I've been in the business ever since. And really, this came along what is called Medicare 10, where they call the policies by a specific letter of the alphabet, you know, A, B, C, and blah, 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 blah. So since 1990, you've had standardized policies. And what standardized means is all the companies sell exactly the same thing. So if you're on a plan F and you've been on one, or you're on a plan G, your G is exactly the same if it's from Mutual of Omaha as it is from AARP, as it is from Aetna. A G is a G is a G. So if you make a change from one company to another, and you're doing that probably because of the price you're paying, you're going to get exactly the same benefits with the new company as you had with the prior company. A G is a G is a G is a G. So where it gets confusing is which one of these should I pick? And in our business, we don't really offer this whole selection to people that are calling in unless they kind of are inquiring and they want this whole description. But most of the people that come in, we just stick kind of in G. So if you're comfortable with that, I mean, you can probably go make yourself a cup of coffee right now, because just going to simplify everything I'm going through here is just, if you're going to take our advice, I'm going to recommend G is what you buy. Or if you went on Medicare before 2020, because you can't buy these anymore, the F. So there's some of you that have F, or some of you that would like to go back to F. And if you went on Medicare before 2020, then you might want to give the F some consideration. It's not really that big of a difference between the two, but we could just simplify this. We put most of the people that are coming in on the G. And you might say, well, you do that because it's the most expensive. Not really. I do it because it has the most benefits. So if you get over here on the left, you say, what are all these benefits? These are the only possible benefits that you could have on a Medicare Advantage plan if it was issued after 1990, which is most of you. So you've got all the possible benefits of these plans, and that's going to include, like with the Part A of Medicare, you got something here that pays all the co-insurance, all that type of stuff, and then after Medicare would run out, all of these supplements would pay for an additional 365 days or a year in the hospital after Medicare runs out of its 150 days. And you can see across, it doesn't matter which plan you buy, they've all got that. Then you get down to the Part A deductible. Almost all of them cover the Part A deductible. Some of them out here cover a percentage of that. There's just no need for you, the consumer, to study all this stuff, because I'm going to go back to, most of the time I recommend G, but I'm just pointing out a little bit of the thinking in standardizing these things. There's only one policy that doesn't cover the Part A deductible, which happens to be about $1,500. So I certainly wouldn't recommend that you buy an A plan, because you're going to go in the hospital and you're going to incur a deductible right off the bat of $1,500. And if you just moved up to the B, you're going to get that. So anyhow, I don't want to spend too much time on these plans that I'm not recommending. I want to explain, it's A, B, C, D, F, G, K, L, M, N. Those are the 10 plans of Medicare 10. And companies aren't required to offer all 10 of them. Many of them don't. They are required to offer the A. And most of them offer the G and the N. Some of them still offer the F, some of them don't. And then some of them have all of them. So it's really up to the companies, other than the A plan, which ones they want to offer. But again, I'm going to keep pointing back to G. And then the only other alternative to G that we use typically is the N plan. And one of the reasons we can simplify this is we represent over 40 insurance companies that sell exactly the same thing. So, and they've got 40 different prices. So, and I've listed some prices in an example that we'll get to in a second, but we can get people in the best plan by simply shopping it and coming up with the best premium for that particular plan. So many times the price we can get you on the G is going to be better than the price somebody else is talking to you about one of these other ones. So just what I want you to get is there's 10 plans available, and they just happen to be called the same thing as the parts of Medicare. This is where people get real confused, is that before you buy a Medicare Supplement plan or a Medigap, you need to understand Medicare, and Medicare is made up of Part A, Part B, Part C, and Part D. And then people say, okay, so how does this Part A differ from that Part A? And they just happen to be named the same thing. It's a completely different world. You could call these 1, 2, 3, 4, 5. They could have used numbers. It probably would have made it simpler, or they could have started at the alphabet backwards and made this the Z plan and so on and so forth. But that's a coincidence. So don't try to match those up with the parts of Medicare, because you'll go crazy doing it. So for simplification, we're going to only talk about the F, the G, and the N. And the reason we're going to stick with the G is it covers the most benefits. And if you'll notice, the only plans that pay the Part B excess charges, and I'll talk about what those are in a sec, is the F and the G. And the F's not even available to people that are going on Medicare in 2020 or 2021 or after. So really only the G is available. And these two plans cover this Part B excess charges. And you're going to have people tell you, oh, that's not necessary. Very few doctors are going to do the balance billing. And so I want to talk to you a little bit about what those are. And I just be careful listening to somebody just kind of off the cuff telling you something isn't necessary. Because what I'm going to tell you is, in an example I'm going to show you later, if, like as an example, if Aetna charges $118 a month for a person in North Carolina for a G, and then they're going to charge you $98 a month for the N, that's a $20 a month savings, or it's a $20 a month surcharge that you're paying for this benefit, because you'll notice that's the only difference. Well, that's one difference. There's actually another difference. But so the insurance companies wouldn't be charging you for it if it wasn't necessary. And if you go in New York, there's like a $70 a month difference between the two. So that would give you reason, maybe I ought to buy an N if I'm in New York, which is the most expensive state for these plans. Well, okay. So what I'm going to say, if you're going to do that, you're going to save $70. But why is the difference $70 a month? I would say that there's more doctors in New York that don't accept assignment of Medicare and they balance bill. That's why the insurance company's got to charge you a lot more, essentially for only this benefit. So what this is that you got a few situations with Medicare. You have doctors who accept Medicare and then those that don't. And there's very few doctors that just don't accept Medicare. I mean, there's some, but they can't treat you if you come in there on Medicare. They can't treat you if they don't take Medicare. So for the most part, when you go into most doctors, they're going to take Medicare. They're going to accept Medicare. What the difference is with excess charges is if a doctor accepts assignment of Medicare, keyword assignment, they are agreeing to only bill you whatever Medicare approves and pays. Or their Medicare is going to pay 80% of it, and then the supplement's going to pay 20%. All these supplements do that. But if the doctor doesn't take assignment of Medicare, he accepts Medicare, or she accepts Medicare, but they don't take assignment, then they can balance bill you. And if you don't have insurance for that, you're going to have to pay that balance bill. Or another way to put it is the G and the F pay that. So when I'm buying my supplement, I'm buying the G or the F just so I have that insurance in case I need it. Now, if we're trying to make these a little less expensive, I'm not opposed to writing an N, but I just want people to know that they don't have that coverage. Okay? And if we're trying to save money on these things, and we really want to go the distance, we need to take a look at a Medicare Advantage plan, because the Medicare Advantage plans, on many of them, the premium is zero. So, you know, if you're trying to avoid these premiums or get these really, really low, then maybe you move completely out of this world and go over to the Medicare Advantage. But in any case, I'm a real fan of the G plan. I don't think it's necessarily worth it to go back and chase down an F if you went on Medicare before 2020, which is a lot of you watching this. The reason is the only thing that it does that the G doesn't is it pays that Part B deductible, and that's only $203 a year. And generally, the F plan is more expensive. The actual premium is more than $203 more. So you're actually paying like $300 a year to get $203 back. It doesn't make a lot of sense. But there's some people that just love knowing that everything's covered. If you're one of those people and maybe you were under the mistaken assumption that the F went away, it didn't go away. If you went on Medicare 2019 or before, even just Part A, you can buy an F. You just call this number. We're in 50 states in the District of Columbia. I'll take care of you. Now, I want to talk about the pricing of this, Because once you've decided, okay, so I'm going to go this supplement route, or I'm already there and I've got a G plan, or maybe you're on one of the other plans and you say, I want to upgrade to the G or upgrade to the F. Okay, so now we've settled in on which plan we want to get. Now we got to decide what company do we want to buy it from. And I've given some examples here of 2 plans. Okay, and these are 6 companies: Aetna, AARP, Mutual of Omaha, Humana, Blue Cross Blue Shield, and Cigna. Okay, these are 6 big companies, well known. There's 35 other ones that you probably haven't heard their name or you don't recognize their name, and many of them are just as good as these. These are across the country, and so I've just used them as somewhat of the standard, but I want to show you the differences in pricing. So these plans are priced differently depending upon the state you live in. So if you're in North Carolina is on the lower end of the premiums pricing. There's a few states that are less. North Carolina just happens to be where I'm standing right now and where my office is and where my home is. But if you're in really most states, if you're in one of the 30 to 40 states that charges somewhere around these numbers, they're going to be very similar to North Carolina. Then I've added in California is a tier. This stuff is more expensive in California, but it's still within the realm of reasonable. So when you get the expensive states or more expensive states, plus there's like 37 million people or 39 million people in California, so I need to have their rates up here. Florida is going to be even more than California typically, and I'm showing you the prices there across these 6 companies. And by the way, this is for a 70-year-old male who's single, doesn't smoke, and he lives in these states. So if you're a female or you're married, it's going to be, or you live with another adult, it's going to be less than this. If you're older than 70, it's going to be more than this. If you're less than 70, I'm just using a 70-year-old male because men pay more than women in most states. And going across, and the most expensive place to buy Medigap or Medicare Supplement in the country is New York. And, you know, if I'm in New York, you can buy the exact same Plan G from AARP, United Healthcare, for $278 a month, and the exact same plan with Humana is $398. Now you can go over in another state and Humana's is less than AARP. So this needs to be done specifically to your state, your zip code, and then your plan selection. And then you can compare the costs of the Plan G to the Plan N. So if you're trying to save a few bucks, and frankly, New York people that want to buy a Medicare supplement, many of them buy an N from us. We do a lot of business in New York. And then many of them also choose the Medicare Advantage just because the overall cost is up there in the $3,000–4,000 a year for the supplement, and they can get a 0 premium or a really low premium Medicare Advantage that includes a drug plan. Some of them will lean there. Other people are like, no, I don't want to be in that managed care system. I want to stay on original Medicare. Then they're going to get a supplement. And then once you're in the $200, $300 a month premium, well, why not buy the best? And so they're going to end up on a G. So I've talked around this a bit in circles because it's really not necessary to go into this kind of detail when you're studying these things. What I find with customers that I'm talking to is, you know, you've got Medicare Supplement, you got Original Medicare Part A and Part B, and then you've got Medicare Advantage, the HMOs, the PPOs, and then those include a Part D plan. If you're over here on Medicare, Original Medicare, this and the supplement, then you have to buy a separate D plan. And people are just in a state of flux. And what a lot of people end up doing is just not doing anything. They just, they freeze up and they say, what I'm doing is pretty well right now. And some of them are sitting on an expensive supplement. Because we have customer after customer after customer that's coming in. And when we kind of wade through the stuff, we find out that they've got a plan G or they got a plan F, and they're paying $250 a month. It may be with one of these companies. It may not. They've had the same plan for 4 or 5 years. It's paid very well when they got sick. But when we run the numbers on them, we can buy the exact same plan G and save them $60, $70, $80, $90 a month, getting exactly the same thing. And then you're going to have to pass underwriting to do that. So we got to ask you some health questions. But these things is pretty liberal and pretty easy, and we got 40 companies to choose from. So don't, just because everything's fine, if you're paying a lot for this Medicare supplement stuff, you just may want to check into making a change of companies. And you can do this, by the way, any time of year. 365 days a year, we can make a change in your supplement. It's only, the fall time here is only limited to the Medicare Advantage plans and the Part D plans, that you can only do it in this 7-week window. So I'm Hans Scheil, and I thank you for listening.